Thank you, Subhashini. And I was tasked to address this talk to graduating fellows from HPB programs, but I think what I have to say can be used for anybody that's looking for their first-time job with an interest in HPB surgery, whether it's in the community or at a university setting. I have no disclosures. So first piece of advice is during your recruitment, this is a singular opportunity for you to get what you really need in any type of practice. And you know, there's that old saying, be careful what you ask for and get it up front, because once you're there, it's less likely you're gonna get it. So do your homework up front and educate yourself about the infrastructure and the place that you're gonna go work at. Because you really have the opportunity to exert some leverage during your recruitment. So what are the key issues that you should consider? It really depends on what type of program you're looking to join. Is it a brand new program, or are you tasked to create it? And that will depend upon the current state in the hospital in which you're gonna work at and what the desired future state is gonna be. So these issues I'm gonna go through pretty quickly. And they're not meant to be prioritized. The priority is going to be very different for everybody. So the first question you should ask is, what's the purpose and goal of your recruitment? Is it to create a new program or to join an established one? Will you be welcomed by everybody, or are you going to be a perceived threat to practitioners who are already there? Clearly define your role and your responsibilities from the get-go. You should do a needs analysis. What are the needs of the community and the region, as well as your own department and hospital? And what are the needs of your future colleagues? Is it just to have another surgeon on staff, or to be used in backup? Or how are you gonna fit into that community? What are your lines of reporting gonna be? If you're joining a private practice, it's gonna be your partner, obviously. But if you're in a bigger hospital, it may be to a section leader. It may be even be outside of your department to a CEO, for example. But you want to figure out who you're going to report to. A key thing for everybody going into practice for the first time is to have a mentor. Ideally, it's somebody you're going to be working with that's in your hospital, but doesn't have to be. It could be a mentor from outside, from your training. You need to have, obviously, partners. Who's going to be your clinical backup? My personal perspective is, if you're an HPB surgeon in the community, it's dangerous, and it certainly will be challenging for you to take on difficult cases without having an excellent surgical colleague. Who do you go to for problems? From a system perspective, it's key to find out what the leadership knows about the field of HPB surgery. Do they need to be educated? That's your role if they don't have an HPB practice there yet. Do they know their outcomes? Is there a business plan? If not, offer to create one. Is there a marketing program? This is probably the most important thing to me, and that is your vision and philosophy towards healthcare. Or is it in sync with the people who are hiring you and the physicians that are already in practice? To what extent will they invest in you and the program? And my sort of mantra is, if you can't do it safely and effectively, you should not be doing it at all. So figure out what is doable and what is not. Understand the culture of the people in practice you're going to join. Are they interested in quality and safety, patient-centeredness? Does that trump all other things as opposed to, say, just numbers and financial issues? Are there harmonious relationships between all the disciplines? Because we know this is a multidisciplinary thing. Is there respect for people across the disciplines? How are problems solved interdepartmentally and between people? Will your opinion be listened to and trusted? There should be clear goals and expectations. And when you look at a business plan, are there realistic, achievable, agreed upon goals? If not, create it. What resources exist for you to execute that plan and have a timeline for execution. You should always look at the fiscal health of the organization. Are there financial threats, or is there jeopardy of the organization that you're going to join? The last two organizations I worked for, both financially failed and were taken over. One way to look at this is look at the bond rating for the hospital for the past 5 years and ask them what their days of cash is on hand. So here's probably the most important thing that we all know, and that is, are there appropriate clinical resources for you to do HPB surgery? And I've listed all the disciplines here that we all know. But between those, is there 24/7 coverage across all service lines? Do you have a modern OR? Do you have good equipment? Is there robotics? If so, how is it orchestrated? Is there a bedside assist that's going to be assigned to you? You need to have a dedicated, constant OR team for doing complex and MIS HPB. The ancillary services, we all know, don't assume that if you're coming out of a university training program that these things are going to exist in a community setting. You need to ask about them. Timely access to care. Are you going to have your own OR block? Is there easy access to get patients in, both in the clinic and in the OR? And what's the clinic support staff to enable you to do that? So often I've seen people recruited to places and they don't even have an office or a desk to sit at. Oh, by the way, there's no OR block either. So 24/7 coverage is key across the institution for all the disciplines. And inquire, what about the depth of services? Do you have just one interventional endoscopist, one interventional radiologist? What happens when they're out of town? You're going to shut the program down? You're going to stop doing Whipples or major liver resections? The compensation model is always an important thing. You need to understand it. You need to dive into it. You know, what are the issues? Base pay, incentive pay? Is there an opportunity to renegotiate your contract after a particular period of time? Are you going to wind up paying taxes to your section head or your department? Is there a non-compete clause? Data and outcomes. You should definitely inquire, do they know their outcomes? What's the clinical volume? Understand where it comes from. Or if you're going to grow a program, what's the target population and region you expect to get that growth from? Personal ask. Is there going to be an opportunity for infrastructural upgrades, such as a modern OR, or you need to buy new equipment such as intraoperative ultrasound machines, or they need to buy a robot? And like I said, office space. Your time. What are the call requirements? Is there extra pay for extra call? Are you going to have protected non-clinical time for CME research mission work, for example? If so, get it in writing. Is there an effective tumor board? How does it function? Who regulates it? How is the information disseminated? The current state, this is key thing. Who are the key clinical leaders that people respect in this community? Seek them out and talk to them. Find out if there are bad apples also, and are there political battles? And finally, and most importantly, talk to the people that work there. Are they happy and content? If not, there'll be a high turnover. Are there any recent departures? If so, hunt them down and talk to them. Find out about the skeletons that might exist in the closet. Thanks for your attention.